The real benefit of the new technology that we have, where we're actually biopsying the cells here at the blastocyst stage, is you get more cells. So here you're taking one cell out, here you're going to get 4 to 8 cells. And the other interesting thing is that there's something called embryo mosaicism, where there may not be a complete concordance of what you biopsy with what remains in the embryo, and that risk will go down if we do a day 5.
What percentage
of mosaicism? You know, it's really not known. If you ask, is there a randomized controlled trial that says that, it's really not known. I think the feeling is from some of the observational studies, 5%, 3 to 5% in that range there.
So there's a 3 to 5% chance that what you biopsy is not what you've got?
Yes, yeah, that happens sometimes. And that risk goes down as you provide more cells. And so that's the enthusiasm of doing a day 5 biopsy.
And just why not a day 6 or a day 7? If you want more
you know,
cells?
we've done day 6 biopsies. Sometimes embryos lag behind a little bit, and you can do a day 6 embryo. So there's experience with that. I don't think there's any experience with day 7 biopsies. Have you done it?
No. I'm just wondering, what's the downside to waiting?
I think it probably has to do with the integrity of the embryo and the ability of it to withstand the cryopreservation process.
Okay.
Really, an embryo subsequent to that should be in communication with the endometrium, should be implanted.
I see. So, it should be implanted. I see what you're saying.
Yeah.
So, you freeze
So you do a biopsy, you freeze the embryo, wait for the results, and then down the road, and I don't know what Dr. Bush has counseled Wendy on, but let's say a 2-month interval, you would thaw those embryos and replace it. And now the benefit is you have the selection bias that not only do you know the embryo looks good morphologically, but you know the integrity of it from a genetic point of view is normal also. Because the problem we have here is you can have an embryo that looks normal, yet there is still some chance that it may not be genetically normal.
Right.
And the incidence of that genetic morphology discordance kind of varies, probably most importantly by the patient's age. So if you have a young woman age 20, there may be a discordance of 20%. A woman age 42 may have a discordance of 70, 80%. So having more information about the integrity of the embryo is obviously a benefit. The other thing is people feel that if you put the embryos back in a more, in quote, out quote, natural environment, meaning not a hyper-stimulated environment, because you have to remember, Wendy went through all of this, and now her hormone levels are super physiologic of what they would normally be, and some feel that there'll be a better prep of the endometrium in a non-stimulated environment.
So
it'll be a prep when they do her FET, where she will.
I'm losing you.
So when they do her frozen embryo transfer in a couple months, she won't be taking drugs to stimulate her ovaries to produce multiple eggs.
So it'll be a couple months when they implant the embryo.
Yes.